Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, welcome back to my YouTube channel. I'm Yunika Septiana Ambarsari, but you can call me Nika. So, first of all, let me thank you guys for coming here and watch this video. In this video, our topic is one of the most popular topic in the world. Yes, it is coronavirus. The subtopics we will discuss are what COVID-19 is, discussion about COVID-19, how to treat, and finally prevention. Okay, here we go. The first, what is COVID-19? COVID-19 is an infectious disease caused by the recently found virus known as SARS-CoV-2 or coronavirus. Before the outbreak originated in Wuhan, China on December 2018, there was no information about this virus. This virus is spreading very quickly and has spread to almost all countries, including Indonesia, in just a few months. This has led several countries to implement policies to impose lockdowns in order to prevent the spread of the coronavirus. In Indonesia itself, a large-scale social restriction or PSBB policy was implemented to reduce the spread of the virus. Coronavirus is a collection of viruses that can infect the respiratory system. In most cases, this virus causes only minor respiratory infections such as the flu. However, this virus can also cause severe respiratory infections such as lung infections or pneumonia. The coronavirus that causes COVID-19 can attack anyone. When viewed from the percentage of mortality rate divided by age group, the age group over 60 years has a higher percentage of mortality than other age groups. In general, there are three general symptoms that can indicate someone is infected with the coronavirus, namely 1. Fever, body temperature above 38 degrees Celsius, 2. Dry cough, 3. Out of the breath. But there are several other symptoms that can also appear in coronavirus infection, although they are less common, namely 1. Diarrhea, 2. Headache, 3. Loss of ability to taste or smell, 4. Skin rash, and 5. Conjunctivitis. Then we all must have wondered, how can someone get or contract the coronavirus? A person can catch COVID-19 in various ways, namely 1. Accidentally inhaling the droplets that come out when a person with COVID-19 coughs or sneezes. 2. Hold your mouth or nose without washing your hands first after touching an object that has been splashed with the saliva of a person with COVID-19. 3. Close contact with people with COVID-19. To confirm a diagnosis of COVID-19, the doctor will perform the following tests. 1. Rapid test to detect antibodies or IgM and IgG produced by the body to fight the coronavirus. 2. Swab test or PCR, polymerase chain reaction test to detect the coronavirus in sputum. 3. CT scan or chest X-ray to detect infiltrates or fluid in the lungs. A positive COVID-19 rapid test result most likely indicates that you are already infected with the coronavirus, but it could also mean that you are infected with other germs or viruses. Conversely, a negative COVID-19 rapid test result does not necessarily indicate that you are absolutely free from the coronavirus. If someone is positive for the coronavirus, there are several steps to relieve symptoms of COVID-19 and prevent the spread of the coronavirus, namely 1. Referring people with severe COVID-19 to undergo treatment and quarantine at a referral hospital. 2. provide fever and pain relievers that are safe and in accordance with the patient's condition. 3. Encourage sufferers of COVID-19 to carry out independent isolation and get adequate rest. 4. Encourage sufferers of COVID-19 to drink lots of water to maintain body fluid levels. But don't worry, there are several ways to prevent transmission of the coronavirus. The best prevention method is to avoid the factors that can cause you to be infected with this virus, namely 1. Apply physical distancing, which is to maintain a minimum distance of 1 meter for other people and do not go outside the house first unless there is an urgent need. 2. Use a mask when doing activities in public places or crowds, including when you go shopping for groceries and attend worship on holidays, for example at Al-Adha. 3. Routinely wash your hands with water and soap or hand sanitizer that contains at least 60% alcohol, especially after doing activities outside the home or in public places. 4. Do not touch your eyes, mouth, and nose before washing your hands. 5. Increase endurance with a healthy lifestyle, such as eating nutritious foods, exercising regularly, getting adequate rest, and preventing stress. 6. Avoid contact with sufferers of COVID-19, people who are suspected of being positive for the coronavirus, or people who are sick with fever, cough, or runny nose. There are several steps you can take so as not to transmit the coronavirus to other people, namely 1. Do independent isolation by living separately from other people for a while. If this is not possible, use a different bedroom and bathroom than those used by other people. 2. Do not leave the house except to get treatment. 3. If you want to go to the hospital when your symptoms get worse, you should first contact the hospital to pick you up. 4. Forbid other people to visit you until you are completely cured. 5. As much as possible, do not have meetings with people who are sick. So guys, that's all from me. Hope you all understand. Don't forget to always stay healthy and stay at home.